Welcome to Lifeline HMS, your complete hospital management solution designed to simplify everyday operations. In this tutorial, we'll be exploring the Doctor Management module, showing you how to configure doctor settings, manage schedules, assign departments, and customize services. Go to All Users and click on Doctor section. To add a doctor, click on Add Doctor on the top right corner. Here you'll find three main categories: personal, professional, and address details. Start by entering the required personal information: doctor's name, contact information, ID, and email. Next, add professional details, like department, designation, joining date, and along with that, assign the shift, receptionist, and the working days of the doctor. Next, add the appointment and payment details. This section defines how the doctor's appointments and payments are managed. Enter the amount charged per appointment. Set how long each consultation lasts, for example, 15, 30, or 60 minutes. Choose how far in advance patients can book appointments, for instance, 7 or 30 days. Under salary type, you can choose how the doctor is paid, either on a fixed salary or on a share basis. In a fixed salary setup, the doctor receives a set amount each month, regardless of the number of patients seen. On the other hand, in a share basis system, the doctor earns a percentage of the revenue they generate through consultations or procedures. For example, if a doctor's consultation fee is $2,000 and their share is 50%, they would earn $1,000 per patient. Specify the payroll frequency such as weekly or monthly. This ensures automated and transparent salary management according to your hospital's model. You can choose how the doctor is managed, either self-managed or admin-managed. If it's admin-managed, the admin controls all shift timings, working days, and schedules. If it's self-managed, the doctor manages their own shifts and availability, and the admin can't make any changes. Now add the complete address, including city and postal code for accurate records. Once done, click Save to create the doctor's profile. Doctor will be automatically added to the list. To update a doctor's information, simply click on their name in the list. Here you can edit any personal, professional, or address details, and even add or modify certifications and degrees. Click the Edit button, make the required changes, and then click Update. Your changes will be saved successfully. Similarly, you can make changes to an existing address or add a new one. To add certification, click on the Add Certification. A small form or pop-up will appear. Here, enter the name of the certification, the organization name, date of issue, and expiry. Once all fields are filled, click Add, and the certification will be added under the doctor's profile. Click on the Add Degree button to add degree. A small form will appear where you can enter the degree title, such as MBBS, FCPS, or MD, along with the institute or university name, degree level, and the year of completion. Once all details are entered, click Save. The degree will then appear under the doctor's qualifications list. Next to Details is Appointments tab. The Appointments tab allows you to check all upcoming appointments for each doctor. You can filter results by date, whether you want to see appointments for a day, a week, or an entire month. In Assigned Receptionist tab, you can view or change the receptionist assigned to the doctor. Here, you can either assign, unassign, or change the receptionist at any time. In order to assign or change the receptionist, click on the Assign Receptionist button on the right side. A list will appear where you can choose either a general hospital receptionist or a department receptionist based on the doctor's department. Once selected, click Assign to confirm. If you ever need to remove or replace one, simply click Unassign and select a new receptionist. The system will update automatically. Next, let's look at the Configuration section. Here, you can edit or update the information provided earlier for any doctor. You can also select whether the doctor is admin-managed or self-managed. If the doctor is self-managed, they can directly adjust their own availability. If admin-managed, then only the admin can assign shifts, schedules, and appointments for that doctor. You can also modify the payroll type, whether the doctor is on a fixed salary or a share basis. If you choose share basis, you can define the percentage that will be assigned to the doctor for each consultation or service provided. Here you can also modify the previously added information, such as designation, department, fees, appointments, etc. Another important setting here is the option to make a doctor the manager of one or multiple departments. Once assigned, that doctor will have the authority to make changes within those departments, such as managing staff or schedules. Click on Save Configuration to update the changes made. The Schedule section within Configurations allows either the admin or the doctor to set or modify availability and assign shifts according to hospital timings. You can modify schedule by clicking on Edit. Here you can select and change the shift and weekdays. Click Save, and the changes made in the shift will be updated. When it's self-managed, the doctor can change the timing and availability accordingly. Lastly, we have diagnostic services. This option allows you to add any specialized service offered by the doctor, such as physiotherapy, fracture management, or injury care. To assign or add a service, click on the Assign Service button. From the list, select the service you want to link with the doctor and enter the overridden fee if applicable. This fee will be added separately to the patient's bill whenever they choose to avail that specific service. More services can also be created and customized under the Services section in the Master Control. You can follow the same process if you want to edit any information or configurations for other doctors or users within the system. And that's a complete walkthrough of doctor configuration in Lifeline HMS. If you found this tutorial helpful, don't forget to like, share, and subscribe to our channel for more step-by-step guides. Thanks for watching, and we'll see you in the next tutorial on Lifeline HMS. That's where healthcare meets efficiency.